Prenatal and mental conditioning establishing interpersonal relationship between mom and fetus. Attachment is a set of internal behaviors that would cause the infant to become close related to his or her mother or caregiver, who is usually the mother, was the first introduced for the postpartum period, but it is believed that the attachment starts long before birth during pregnancy. According to the evidences, this relationship could be affected by different factors like nationality, cultural, mental, and social conditions, an individual's past, namely, women who have not experienced a secure attachment during their childhood might encounter problems in developing an attachment to their infant. The review of literature about related factors to prenatal attachment among different groups of pregnant women have emphasized that despite the numerous evaluations and different methods of studies, further studies are required in this field. Therefore, considering the importance of attachment in child's development and mother's health and various factors that are effective on this matter, and also lack of necessary information in this regard in Iran, the research team decided to conduct this study to evaluate maternal fetal attachment during pregnancy and its not postpartum consequences on mother-infant relationship. The attachment theory was first introduced by John Bowlby in 1960s about the mother-child bond. He defined attachment as a set of internal behaviors that would cause the infant to become closely related to his or her main caregiver, who is usually the mother. Although this concept was first introduced for the postpartum period, but it is believed that attachment starts long before the birth. During pregnancy, in other words, attachment starts when mother finds out her pregnancy, and this is the real start point for fetus. Dialogue with his or her surrounding world. Cranley has expressed mother's attachment as her enthusiasm in behaviors for interacting with her fetus. And Muller believed that it is more than just a behavior and has defined as a unique relationship between the mother and her fetus. The common characteristics between all of these definitions is emphasis on the importance of maternal-fetal relationship. Development of this relationship is important due to its role in creation of attachment after birth. Some researchers have reported that mother's attachment to the fetus would keep developed during pregnancy, and it would help her prepare for transition to the motherhood period. Some studies have shown that prenatal attachment is an important factor in predicting postpartum attachment behaviors. It is associated with mother-infant postpartum interactions and communications, and it is an important role in the health of a pregnant mother and her fetus. Attachment, which one is of the essential needs of human beings, would act like an invisible connection and maintain a close relation between the mother and the child, is considered an important part of the result of the studies conducted on human beings. And other species have revealed that care deprivation has a major effect on the evolution of regulatory system and coping with stress. Mother's reaction to child stress is considered an important source for coping. Therefore, infants with sensitive and despondent parents would learn that at the time of stress, parents are always available and it would be more chance for them to have secure attached relationship with their parents in the future. But infants with insensitive parents would learn that parents are not always available at the time of stress and crisis, so they would probably develop an insecure relationship with their parents.
Only 2 cells are needed to create a baby. 2 cells and a miracle. In just 9 months, this pair of cells blossoms into billions of cells. Gently nestled and protected in a mother's womb, a tiny human thrives. Together, mother and baby share this journey of life, this magnificent adventure called pregnancy.
I hope you enjoyed this video. Please click the link below to sign up for Pregnancy Chat, where it's our mission to nurture you through your pregnancy and childbirth. If you know someone who might benefit from this video, please share it, and if you have any comments or questions, please post them below or post them at pregnancychat.com. Thanks for watching. I'm Monica, and we'll see you next time at
Baby kicking! 7 facts you need to know. Your baby has been moving long before that, but the sensation is unfamiliar, and you might not recognize it for what it is. A baby's movements aren't very strong in the earlier stages of pregnancy. Some mothers think they just have wind. If the placenta is at the front, anterior of your uterus, it may buffer the feeling of your baby's kicks for some time. Women having their second or subsequent baby usually recognize the flutters of their baby's movement much earlier, even as early as 12 weeks. Number 2. Why do babies kick? Babies tend to move mostly in response to what's happening in their environment. Too much noise, light, or even certain strong foods can stimulate your baby into kicking and moving. Babies also need to stretch and move for relaxation. If you're moving about, it can be soothing for your baby. They'll often relax and even go to sleep. Mothers-to-be who participate in relaxation exercises such as meditation or yoga may find their babies are quieter. This study found that pregnant women undertaking a guided imagery relaxation exercise experienced a reduction in fetal movements. The exercise resulted in physiological signs of relaxation in the mother, such as lowered heart rate, respiration rate, and skin conductance. This, in turn, lowered fetal heart rates and decreased movement of babies. Number 3. How many baby kicks is normal? The average number of kicks falls between 15 to 20 per day. Remembering this includes all movement, not just kicking your bladder. Every baby is different, and this includes their movements. Some babies literally sleep all day and move at night when you're asleep, whereas others seem to be moving all the time. Babies rest and sleep in the womb as much as 17 hours a day, usually for periods around 40 to 50 minutes at a time. If you've been busy and on the move, you might not notice your baby's wakeful movements. Most pregnant women will notice a peak in activity after meal times, after being active, and during the evening. Number 4. When should I count kicks? There isn't a normal pattern for movements, but you've probably worked out what is normal for your baby. As your baby grows and develops, you shouldn't feel less movement. Rather, your baby has less room to move and the sensation of her kicks will feel different. Sometimes it might feel like your baby's movements have decreased. It's important to contact your care provider immediately if you notice the following. Experiencing less than 10 movements in a 2-hour period, reduced or no movement in response to external stimuli like loud noises, patting or prodding your belly, or the sound of you or your partner's voice. A gradual decrease in your baby's movements for more than 2 consecutive days. Reduced movements can mean your baby isn't getting enough oxygen or nutrients. Your care provider can monitor your baby and check their well-being. Number 5. How to check baby movements? It's easy to miss feeling your baby kicking, especially if you've been busy and active. If you think your baby's movements have been reduced, always contact your care provider for advice. Most commonly, women are advised to lie down on their left side, support your belly with a cushion, for 2 hours. You should feel at least 10 separate movements in that time. If you don't notice movements in a 2-hour period, you should contact your care provider immediately. It's important to have your baby's well-being monitored sooner rather than later. Number 6. Does reduced baby movements mean something is wrong? While it doesn't always mean something is wrong, reduced movement can be an indicator of fetal distress from lack of nutrition or oxygen. A maternal and fetal assessment will be done to look at the cause of reduced fetal movements. This involves an ultrasound to check blood flow of the placenta and baby's well-being, as well as how they respond to stimuli. Sometimes a problem is detected, and your care provider will discuss with you how to proceed if your baby needs to be born early to prevent further complications. Number 7. Will my baby move less after 36 weeks? Your baby should always be moving throughout the day. After 36 weeks of pregnancy, babies have much less room for big movements like kicks and rolls. This doesn't mean you should feel a reduction in movement. They'll still use their hands to explore their face and body, play with the umbilical cord, and try to stretch in their cramped surroundings. Regular and rhythmic movements will indicate your baby has hiccups, and some babies have hiccups at the same time every day.